Bioavailability of drugs. So in pharmacology, the definite interval is used to measure the overall exposure of a person to a drug during the course of a treatment. So this is what's called the bioavailability of the drug. So as you can imagine, if you're giving someone a drug where you want to minimize exposure, say you're doing radiation treatment or something where whatever you're exposing them to is not great for their overall well-being, but targeted to help one specific part, you want to keep the bioavailability down. So the total exposure of a drug is going to be equal to the area under the drug concentration curve. So this graph should look familiar because we worked with it in an earlier section, because this represents a surge function. So when we look at the area under a surge function, we can calculate how exposed someone has become to the drug. Now, like I said, not all drugs are troublesome. There's some drugs that exposure to the ingredients is not a big deal, but you can think about some cases where you'd want to minimize the exposure to certain ingredients. So let's look at just a couple quick examples of how this is used and what sort of information we can get by looking at area under the curve and comparing different types of functions here. Example 6. 2 drugs are given to a patient and their concentrations are measured over time. Which drug was absorbed most rapidly? So the way that we figure out absorption is we want to figure out, 1, which drug peaks the fastest. That means it's reached its maximum concentration. But we also want to look at when these drugs actually finish running their course and get out of the body. So in this case, we can see that drug A reaches its peak faster, and then it also finishes its own course faster. So it leaves the body, it gets back down to 0. So that means that this drug was metabolized more quickly than drug B. It took less time to peak and get out of the body than drug B did, based on the shape of this graph, which is the rate at which the concentration is changing. So in this case, it's going to be drug A. So again, if you're looking for when drugs are absorbed most rapidly, you're looking first for the peak, and then if the peaks are different, then you want to see which one came first. So here A came first, so it was absorbed most rapidly. If, however, you're in a scenario where the peaks are the same, then you want to see which one gets out of the body first. In this case, drug A also gets out of the body first, so it qualifies for both conditions. But we look at the peak first, and then if you can't tell which one peaked first or if they're the same, then you look at which one leaves the body first. Let's look at another example. Example 7. 2 products are being tested for pain relief. The graphs of both products are given below. Use the graphs to determine which drug works the fastest and which drug has the largest bioavailability or overall exposure. So, which drug works fastest? So again, that has to do with absorption. Which one is absorbed the most rapidly? Which one peaks first and hits its maximum concentration, because that one's going to be working the fastest. So for this part, we can see that product A reaches its maximum before product B, which means it's working faster and being metabolized faster. So product A is going to work the fastest. Now, the second part is which drug has the largest bioavailability or overall exposure. So what you'll notice is because drug A peaked so fast and got out of the body so fast that the area under the drug A curve is pretty small compared to what's happening with drug B. So drug B has a lot more area under the curve. So the largest bioavailability is going to be product B. So depending on what the ingredients are of this particular drug, we may have concerns about how much exposure we have because of product B. Because it stays in the system longer, you're exposed longer, and the area under that curve is much larger than drug A.